My name is Dr. Fidelis Madondo. I'm the Medical Director of the EMS service at MRI, and I'm also in charge of the training department, which actually looks after healthcare providers in terms of resuscitation courses. And we also offer non-professional courses in first aid and fire awareness. So I look after both departments, and I've been in charge of them for quite a bit now. When a person has got an emergency, any person in Botswana or outside Botswana for that matter, they phone our medical desk or the alarm center. When you're in Botswana, you call 992. That's our toll-free number. If you are outside the country, you phone 390-1601. Then you'll be able to reach our alarm center. Once you get in touch with them, they will ask you what your number is in case there's a sudden cutoff, and then they need to phone you back. And then they will also ask you what your emergency is, so that they know the right resources to mobilize. Other details like history, your insurance, whether you are not on insurance or not, they need to know about that. And once they have sufficient information and an assessment of how urgent your call is, then they will dispatch an ambulance from the base. These ambulances are dotted throughout the country. We have bases in Francistown, Palape, and Maun. So the nearest ambulance to the center of emergency is the one that is deployed, and then the appropriate people will come. Depending on your level of emergency, this might be a doctor or our usual paramedics who are in the ambulances. Then they will take you to the nearest appropriate facility. This could be a hospital, clinic, or if the hospital that requires your attention is far away, we can actually send an aircraft to pick you up, a helicopter or a fixed-wing aircraft. Basically, in a nutshell, that is how we respond to emergencies. When responding to emergencies timelessly, I think training is of the essence. People who have been trained know how to respond. So we emphasize a lot on training, both our people in the alarm center and the people that work in the ambulances and in the aircraft. So when there's an emergency, they know exactly what to do and when to do it and how to do it. So again, in brief, the training is key, which is why we also look after the training department very well to make sure that we sharpen the sword and our people have the cutting edge. The COVID-19 pandemic has really caused havoc throughout the country. Initially, the government was looking after all COVID-positive patients until around about mid-January, when they asked for help from the private EMS providers. So as MRI, we've been transporting COVID-positive patients, both our clients who are on medical aid and those who are able to afford the service. Again, as you may appreciate, when we move COVID-positive patients, it's not like your ordinary emergencies that you're dealing with, because then there's the element of PPE or personal protective equipment that's required. And this has sort of increased the costs of servicing such clients, but we've always been prepared. We have our PPE that we use on the ambulances, that we use on the aircraft. And in addition, if we use these vehicles or aircrafts, we are able to disinfect them using our sterilizing chemicals that we have acquired and that we keep handy in order to deal with COVID patients. So yes, we are responding to COVID patients. We are very prepared, and we have made an impact in terms of reducing suffering and anxiety in the clients that contact us. Like I mentioned at the beginning, the Training Academy offers two types of courses. We break them into healthcare professional courses and the non-professional courses. The healthcare professional courses are aimed at healthcare professionals, doctors, nurses, paramedics. These courses are short courses And there are emergency courses that teach you how to deal with an emergency. If a patient collapses in hospital, out of hospital, in a public place, do you know what to do as a healthcare professional? These are the compressions that you see on the chest, the mouth-to-mouth breathing that we have seen in terms of dealing with emergencies in the public place. But in the hospital, doctors, nurses, and paramedics, they do not train to the same level of emergencies that we offer them here. There's always a gap. This is why all healthcare professionals are encouraged to come to our facility and learn how to do proper CPR, which stands for cardiopulmonary resuscitation. I'm sure you've seen movies where people have been shocked with that shocking machine to try and restart the heart and so on. We don't teach you the movie star way, we teach you the proper way of how to do it. And then when we come to the non-professional courses, these are the first aid and fire awareness courses. First aid is important in everybody's life, and the encouragement is that everyone should do it. When a person is involved in an accident or collapses at home, people need to know how to deal with such an emergency because their action can save lives. If you wait for emergency people to come, a delay of 5 to 6 minutes with the brain having no oxygen can result in permanent brain damage. Therefore, when people have been taught how to do first aid, they will know how to do a mouth-to-mouth resuscitation. They will know how to do chest compressions. They will know how to position the patient while the emergency services are coming. They will also know how to deal with bleeding, which are the main causes of loss of life if we act slowly. The fire awareness course is very important as well. A lot of people have got fire extinguishers, but they have no clue how these fire extinguishers work or what type of fire goes with what extinguisher. Because we have electrical fires, we have fossil fuel fires, we have paper, cardboard, wood fires. All those are dealt with in a slightly different manner. So these courses are important for people to come and learn so that they can respond to emergencies of fire or first aid as the case might be. Training is important, but together with the training, we have systems in place in our call center that help guide in terms of management of the condition and in terms of the speed of response. We have an American system called ProQA, which takes the call taker through the processes of evaluating how urgent a call is. And this minimizes mistakes because it guides the person to make a decision as to whether what they're dealing with is a dire emergency which needs immediate response, or they can ask a few more questions and then give the appropriate advice, like see your doctor, for example, because this is not very serious. The other system that we also have in the call center is called Rapid Deploy. This system is able to locate the caller. So if you call MRI, then we send you an SMS to say, do you authorize us to locate you? Because this has all got some legal implications. And once you respond and say yes, you can locate me on your system. Then using GPS, we are able to respond quite quickly. And in this way, our tagline, which says when seconds count, becomes a reality. We are able to respond in the shortest possible time. Okay, since the advent of the COVID-19 pandemic, we found it necessary to educate our public in terms of how to deal with the pandemic. We do have a testing center here at Block 7, but we also do testing at other centers as well. And people don't know what to do if they've tested positive or what it means if they've tested negative. So we've developed another training element that we give to institutions and individuals called COVID awareness. If you are positive, what do you do? You stay at home, and then how are you monitored? When do you go to hospital? And how do you go to hospital and things like that? So this is a new talk that we have added to our bouquet of trainings that we can give to organizations, individuals, and any other grouping that might want to receive the talk on COVID awareness.